you all, this is Sierra, and today I'm going to do a quick video on how I prepare my medication for the week. For the ones of you who do not know, I have relapsing remitting multiple sclerosis, and I am on a treatment. In my world, they call it disease modifying therapy. So that's basically the different medication they have for multiple sclerosis. They have the therapies in pill form, which I take pill form, infusion, and injections. I've had injections, subcutaneous injections. I've had that treatment before for a few years. It was working well, but I eventually had to get off of it because my white blood cell count was low. I had to get on another treatment. So my next treatment was Aubagio. That's what I am on now. Okay, so I have another video where I talk about the process of ordering medication, and y'all, when I tell y'all it is a beast, it's a beast. It is a lot. Only thing I can tell you all, make sure you all keep a journal with you all of who you talk to. And when I say who you talk to, you're going to be most likely speaking with the insurance company, the pharmaceutical company, and the patient assistance program, because nobody can afford these expensive medications. And anytime you're talking about big money like that, you're going to have to jump through a lot of hoops to get there. It's a lot of red tape to get to that point. But when you do get there, I order my medication through a pharmacy, and it's a specialty pharmacy, but it is delivered through FedEx. So my medication is in this box here, so I'm just gonna do an unboxing of it. And of course, I take Aubagio. That is the disease modifying medication that I take, Aubagio. It's a 1-a-day pill. So I'm gonna go ahead and unbox it for you all. The insurance that I have, you all, I have a plan under the Affordable Care Act. And let me tell you all, the insurance is good. I haven't had a problem with it, but I will tell you this. If you forget to pay your premium for the month, you will lose it. And you're most likely gonna have to wait until the following year to enroll, like I had to a few times, because I made the mistake of forgetting to pay. And then my mom got tired of it, and so she put it on auto draft. So that was a good thing. So my suggestion is, if you have medications like this, it's best to have it on auto draft. Try to get it on auto draft so you know it's coming out your account. Make sure your account is clear so you have enough money to pay for it. So I have somebody to help me, and I'm thankful about that. But I am on one of the plans for the Affordable Care Act, or if other people want to call Obamacare. It's worked for me, and I know it's worked for plenty of people who've had other ailments, cancer, MS, other health conditions. It's a good insurance. So, as you can see, it comes like with the medication. The box is empty now. Put it on the floor. The medication comes like with, I wouldn't call them like packing peanuts, because they're really not. They're just like some type of bubble wrap. That's what I would say, just to keep it. Now it has my information on the front, but the box is, I'll show my name. Yeah, the box is like that. Okay, and also, you all, I don't want to forget about this part. Usually with the medication that you have, they will give you a patient receipt to let you know this is not a bill. On it, they'll include like your address information, your shipping information, whether the items needed to be refrigerated. They will include when it is shifted, the copay and all that stuff, right? But they're also, so that's that. And they're also going to give you education about the drug, okay? they're going to give you education about the drug. So it's about 8 or 9 sheets about the drug, or whatever you have. It doesn't have to be 8 or 9 sheets, but they're going to give you like some type of education about the drug. And when I say education, they're going to let you know what the drug is, what it's used for, and what some of the side effects are. And yeah, so that's what that is. If you have any medications, they give you a number that you can call, and they give you a medication guide and all that other stuff. And when I say medication guide, I mean they let you know about the side effects and the risks. When you take these medications, y'all, it's always a risk, unfortunately. Nothing is really cut and dry. We just have to do the best that we can do. All right, and this is pretty cool. This says start planning for the new year. Start planning for the new year. So this is December. So what this is it says to ensure timely delivery of your prescriptions in the new year, review the health plan information, schedule doctor's appointment, check on prior authorizations or refills. Right. All right. So it's basically giving you like a little checklist on how you can be successful in the new year as far as keeping up with your medications. Okay. So always make sure that you go through these papers. But yeah, this is really good right here. I'm glad that they gave this to us, end of the year type thing. All right. So we put this to the side, put the bubble wrap to the side, put the plastic to the side, put the wrist to the side. And I've been on this medication for years, you all, so I pretty much know the side effects, and I know the side effects that I experience. Now, always make sure that you know how many refills you have, okay? Because if you don't know the amount of refills that you have and you have one left, then that means that, or you don't have any left, that means that the pharmacy is going to have to send over some paperwork, probably through fax or maybe through email, to your provider, to your neurologist. And you know, they're busy, so it can possibly take them a day or two, a couple of days. I'm pretty sure they'll try to get it in as soon as they can, but that can be very stressful, you all. So I'm gonna look. I have 2 refills left on my Bajio, okay? I like to just look at it a little bit, check out the box, make sure it ain't been tampered with, which it hasn't. And then I open it up. And I look at the quantity. I look at the quantity and see how much is in here. Okay. All right, so this with the pill case, this is what it looks like. It has my medication in it. And then on the side, they always have a lot number. They have an expiration date. And that's the lot number, and January 2025. That's the expiration date. All right. Now, like I showed you all last time, I love this pill reminder. And with this, I can just put this around my bottle, and I can just, after I finish taking my pill today, because today is Sunday, I'll put it on Sunday. All right, but right now it's gonna stay on Saturday. Okay, so you all, what I'm gonna do, I'm gonna go ahead and write down my start date, which is the 25th. And I'm gonna put a Bajio, and then one thing that my mother told me to do is when you get these medications, right, always write down the lot number. And the reason why you write down the lot number is because if there is a recall with the medication, or really any product, if there's a recall with the lot number, then you will go ahead and have it on hand. You can check it to see if it's a recall, okay? So in that way, you can ensure that you are safe. So I write down my start date, and I'm gonna write down this lot number here. And I'm gonna write down the expiration date, which is January 2025. Okay, now what I like to do, I don't do it every time, but what I like to do, I like to write the date on the bottom of this pill case. Of course, with this last one, you know, I didn't do, but it's good practice to write down the date because you are gonna have multiple cases. And once you get through with a bottle, go ahead and recycle it. You know, take your personal information off of it if it's up there. But I'm gonna go ahead and write down the date. So let me do that now. Okay. So I did that. All right. So the next thing that I like to do, and I try to take a little bit more time with my medications, like with my MS medication. I can't play with that, y'all. Hey, you all, this is Sierra. So I had to take a quick break from the video to remind you to wash your hands. You have to wash your hands when you are handling your medication. It's best practice because you have bacteria and things on your hands. Go ahead and cut on the water. Okay, you all, I'm gonna go ahead and dry my hands. All right, now this seal, y'all, is most certainly childproof. It's childproof and it's real thick. So with this, I actually have to puncture a little hole in it. All right. Once I punch a little slit in it, I'm gonna open it up. Now, best practice is for you to count your pills. So let me go ahead and pour out my pills on my little plate here. I'm gonna count them by twos. There's nothing in here. And of course they have one of these telling you do not eat, but it's just to keep the medication fresh. That's in the medication. Okay. I actually like to put this back in. This is with the medication. You don't take it though. All right. Now, let me count. It's supposed to be a 30 quantity. The quantity is supposed to be 30. So let me see. I'm gonna count it by twos.
Put this coat.
Okay, you all, so this is 30 quantity right here. I take my time counting it, but I count it by twos and I have it separated in tens here, okay? So this is a 30 count. So what I'm gonna do, I'm gonna put my medication back in the case. Okay, and I close it off. Now, you say, Sierra, is there like a little medication item that I can use to count my pills, like a pill counter with a little thing that goes with it? Yes, there is, but some people may not have access to it, so that's why I just use a regular plate and a knife. All right, so this is my medication. It's my Aubagio, all right? Now, before I put my Aubagio, which is my MS treatment, in my medication box, I put my other medications that I'm taking in there first. All right. Now, I take vitamin D, I take iron, and I take my bladder pills. Now, I get my bladder pills from CVS, and I just picked up a new pack for my bladder pills. Right? This is what I take. And in my condition, I have urinary retention, right? So I'm not able to get all of my urine out of my bladder in one setting. And that's due to the effects of MS, right? And so with this medication, it helps me to be able to release my urine a little bit more and have more regular cycles of urination. So this medication has helped me out a lot. And at first, I was very apprehensive with taking any type of bladder pills, because in my mind, I'm just like, I'm young. I don't want to feel like I'm old. I know older people or middle-aged people, they have issues with their bladder. I'm too young for this. But I had to I came to realization about that when I started having those very painful bladder spasms. And I said, I cannot continue to do this. I'm like, I have to release that urine out of my bladder. And so I talked to my neurologist about it. You know, he told me about it, but I wasn't trying to hear it at the time. But I had to come back. I said, look, I need something for my bladder. And so I've been on several different types of medication for my bladder. And that's the one that I'm taking right now. And that helps out with my bladder a lot. So that's what I take. So what I'm going to do, I am going to go ahead and put my medication in here first, my vitamin D. When I was first diagnosed with MS, I had some follow-up labs after my initial appointment with my neurologist, and I found out that I was vitamin D deficient. So ever since then, like since 2016, I've been taking 4,000 IUs of vitamin D, and it's been helping me out a lot. So I make sure these pills right here are 2,000 IUs. So I put 2 of these pills in my case. I became a pro with this, you all, so I can literally just shake out 2 and go on to the next one. Everybody does their medication differently, so you always got to do what works for you. And the last one, these last 2. So that's how I do it, but everybody does theirs different. Well, I'm not at my home right now. I'm at my parents' home, but I usually have like a large medication box where I put my pills back in. Then I have my iron. And I do the same thing with my iron. Put my vitamin D in. I just take 1 iron pill. So if I have an extra one, I just take it out. Put this back in. Okay. So I have an extra pill that fell in Thursday. Put it in Saturday. So In this case, I haven't taken my pill yet for Sunday, all right? So what I'm gonna do, I'm gonna fill all of my pills up, my AM pills. Because I don't take any night pills, but I'll get to that in a few minutes. Now, I'm gonna go ahead and put my Baggio in my pill case. Sunday. Okay, that back in. Okay, so I put my MS medication in there. And usually what I try to do, I try to put my bladder pills in my box before I do it, but if not, it's fine. And this is child-proof as well. It has a pretty good seal on it. I have punctured a hole in it. All right, so puncture a little hole in it. I'm gonna do the same thing for this one, for my bladder medication. In here, I just have my vitamin D, my iron supplement, my MS treatment, and I have my bladder medication. When it comes to like Tylenol, I have that like in a separate case because I don't take it all the time. I just take it as needed. And my baclofen. When it comes to the muscle relaxer, you all, I don't have it regularly in my case. I have it in another separate pill case, and I just take it as needed. I don't take it regularly. In one of my upcoming videos, you'll see that I was having some issues with my nerves and my muscles because my body became cold, and literally my hand just stiffed up like that. I had a lot of plasticity in it and paralysis. It completely, I would say, froze for a few hours. And so when that happened, I took my baclofen immediately, and eventually it resolved. I don't know when it resolved, but I know it was when I woke back up hours later, my hand was back to normal. I could move it the way I wanted to. So I usually have those. I have my Tylenol for like pain relief, muscle aches, joint pain or something. I have that to the side, and I have my baclofen to the side. Now, let's talk about these pill cases. As you can see, this is a AM and PM pill case. Now, I don't take any more PM pills. I know for a while ago, I was on a treatment for my MS, disease modifying therapy, and it required me to take 4 pills a day. I had to take 2 in the morning and 2 in the evening, but I'm not on that treatment anymore. So I still kept this case because I like how large the pill containers are. I like how large they are. They call this the AM or PM pill organizer. And I don't know if you all have seen it or not, but they actually have pill case organizers that have alarms on them. On the pill case, and you can just type in a time for your medication, and it will alert you through auto and through visual. So you'll hear a beeping sound, you'll see a flashing light. It will let you know. to take your medication. There are different apps that you can use that will link up with your pill organizer, and it will flash, it will notify you, it will give some type of alarm that, hey, it's time to take this medication at this time, it's time to take that medication at that time. And so if you think that will be helpful, then do whatever works for you. The medication organizers, medication dispensers, I've seen them shaped in oval, I've seen them shaped rectangular like this, seen them shaped in circles. They have all kinds of pill organizers. Pill organizers that you can get from, I think I got this one from Walmart. You can get some from Dollar Tree. You can go practically anywhere, I would say, and get you a pill organizer. Now, the issue is when it comes to treatment and when it comes to being your best self, I'm definitely an advocate of taking care of yourself. I need to work on like the diet and exercise area, but I will say when it comes to like taking your treatment, you know that in order to be your best self, you gotta be on some type of treatment. Even if it's you going into the doctor's office and just checking in regularly, that can be good as well. But when you have like a chronic illness, it will be very helpful for you to be on some type of treatment. Now, some people, they don't want to be on any treatment, and that's their choice. But I will say there were times where I struggled. I can't even lie. There was times where I struggled with being on treatment because I'm like, well, I don't like the side effects. I don't like how it makes me feel. But sometimes when I do take the Autoimmune, I have like headaches and just different muscle aches and numbness and different things like that happen. But I just think sometimes it's the medication, but I also think it's just the process of the disease, you know, the disease process. But I just didn't want to take it, especially early on in my MS journey, because I'm like, you know, what's the point? I'm too young for this. I don't want to take any treatment. So if you want to be your best self, you have to consider like the holistic view, you know, of treatment. You take your medication, you do your exercising, you do more healthy, balanced meals. If you do your meditation, you do your prayer, socially, you kind of have to look at it as a way of like a holistic way of managing your health, right? But you know, you are the number one who can, that's gonna help manage your health the most. So that's like, make sure you're staying consistently on a treatment. Make sure you're seeing the doctor. You may say, well, Sierra, I don't have access to doctors. I don't have health care. And oh my God, I completely understand what you mean. And that can be challenging. But I will say this, if your body hurts or something is going on, you can always go to the emergency room. And then you do have your public health departments that you can go to as well. And you'll just have to do the best you can do. You might say, well, Sierra, I don't have transportation. Now that can be a lot, because I know, and the reason why I'm saying that is because when I did like social work in the field, that's where my clients was telling me they was having issues with. So I had to connect them to transportation services to get them to their appointments, especially if they're living in rural areas, or maybe they're living in the inner city area. Ways of helping them remember to take their medication. Maybe it can be a call from a family member. Maybe it can be them just having a calendar. But like I said, it's a lot of challenges sometimes in social issues when it comes to managing your health. It's a lot, and sometimes it can be even more challenging if somebody has like a mental illness or some type of substance use. That can be a problem. But the best thing that you can do, you all, is try to get through life the best way you can. But if you want to be your best self and you want to thrive with a chronic illness, you got to just go out there and seek the services. You may have people, yeah, you got to put, like Mama said, you got to put in the work. You got to put in the work. You got to seek out people. There are services out here. And I'm going to tell y'all, sometimes when you call, you know, agencies and different people, you may not get the friendliest people. But continue, keep on trying and trying and trying. And also too, when you go to like the emergency room or your doctor's appointment or something, most likely they're going to have, if you tell them, look, I need help with this, I need help with transportation, they're going to have a social worker there, or at least a resource. I hope that they will have some type of resource that they can share with you so you can get the transportation that you needed, possibly, so you can get to your appointments, so you can maybe get on some type of generic form of medication, because that happened to me too, because when I lost my insurance several times, I had to get on some generic medication. Did it work as good? Absolutely not, but I was on something. First it was cheaper, it was something that I can afford, and it was what it was. But there are services out here, you all, but you have to put in the work. If you want to be your best self, you have to put in the work, and you have to advocate for yourself, okay? And I just thank God that I've had my mother to help me navigate the system of medications and trying to figure out which treatment works, and those times that I messed up, her trying to figure out what generic could I get on, all that other stuff. It has been a ride, and just I've had a wonderful neurologist, wonderful healthcare team that's helped me along the way. But don't give up, you all. You may have a couple of bad apples out there and people who act like they don't care, and some people just don't care. But they'll care if they get in that situation, or if their family members got in that situation, they'll care then. But somebody is going to eventually, if you feel like you're getting a lot of no's and a now, somebody's going to eventually say yes, and somebody's going to help you along the way. And just make sure, when you're helped, just pass it along the way, you all. And the last thing I would say, when you are getting ready for your doctor's appointments, I have another one coming up in March. My last one was in September, and I think it was late August, and I got my MRI in September, and that came out good, you all. So I have a follow-up with my neurologist in March. If you all are experiencing any symptoms, kind of like what I said last time, make sure you all write it down in a notebook, because like my mama always tells me, doctors and people who are in the medical field, they understand science. And when we say that, they understand what symptom was you experiencing, how long was it, what was going on when this happened, before and after, because that helps them manage your treatment more, okay? Especially if you are on a medication, like, right, they're having to dose the medication, or they're having to just change the medication. Like in my case, it had to be completely changed. Write down the time, write down the date. How long did it last? What was going on? Okay, you all. Well, I'm going to go ahead and take my medication. I'm going to show you how I do it. So, I do not have any orange juice right now, but I know Mom says it's a good idea when I take my iron pills to have orange juice with it. But in the meantime, I have some water here, and I'm just going to take my pill for today, and I'm going to show you all how I do it. So, this is my medication. Ooh, can y'all see that? This is my medication that I am taking today. Put it in my mouth. That was good. I'll probably drink a little bit more water too. All right. Close this off, and okay. And you all make sure you have at least 8 glasses of water per day, or whatever your doctor suggests. I know some people do have fluid restriction, so they have to be careful on how much fluid they consume. But I know at least 8 glasses a day, but just make sure you check in. So I'm definitely going to drink more than that. My mother always tells me, and my neurologist, he really encourages me to drink as much water as I can to stay hydrated. A lot is going on with our bodies, right? A lot is going on with our bodies. So we have to stay hydrated. And there are a lot of benefits to drinking water. I actually did a video on that. I did a video on the benefits of staying hydrated and different ways on how you can stay hydrated. But You definitely want to make sure that you are making sure that once you take that medication, you are flushing your system out. I know this medication it can work pretty hard on the system, right? And so we need to make sure that we flush our system out the best way that we can. And so that is that. So it was on Saturday. This is my medication reminder, right? Now I'm gonna put it on Sunday because I just finished taking my medication. So I love this thing, you all. It's so good. It's a reminder. And I just have my pills in here. And I will put this on my dresser, and that's how I would do it. Today, I'm feeling pretty good. I don't feel like I need a Tylenol. Like I said, I take Tylenols and Baclofenes as needed. I take my allergy pills as needed. So you all, I love you all. I do hope this video was helpful to you all. I want you to be your best self. I hope you got some good things from this video that you'll be able to use and share with other people. I want you to be your best self, and I will see you in the next video. Love you all.